February is Black History Month. It was expanded from a week to a month in 1976 by President Gerald R. Ford, who urged Americans to honor the too often neglected accomplishments of Black Americans in every area of endeavor throughout our history. Tonight, 13 on Your Side, health reporter Elena Holland explains how the actions of two of Grand Rapids' first Black doctors have a legacy of influencing healthcare that lives on today. Elena.
Well, Juliet, in America, there is a big health disparity between Black Americans and other ethnicities. Now, life expectancy for Black Americans is 71.2 years. That's according to the CDC. For white Americans, it's 76.7 years of age. Hispanic Americans, a little higher at 77.8 years, but highest still for Asian Americans at 83.5 years. The Pew Research Center study found 63% of Black adults say lack of access to quality medical care where they live is a major reason why Black people in the U.S. generally have worse health outcomes than other adults. Now, this is a huge topic with many nuances and factors involved, but let's look at one small piece of that. I visited a community clinic to see how its mission to increase health care to an underserved population is making a difference. In the Madison area of Grand Rapids, a health center rooted in history.
We just greet them, try to greet them in love, because you never know how a patient feels when they come through the door.
The Browning Claytor Health Center, affiliated with Trinity Health Medical Group.
So I love this place.
Doris Jefferson, a patient of 9 years.
People look you in the face and talk to you. You don't think that means a lot, but it does.
When she first moved to Grand Rapids, Doris had an issue with her insurance.
And then I met a very good friend in the financial department, and she literally went to Lansing to go to bat for me to get my thing cleaned up.
Without her, Doris can only imagine where she'd be without access to health care.
Yeah, I know a lot of people that struggle. There's so many people that die for things like high blood pressure, heart conditions, diabetes, lose their feet or limbs because they don't have the right care.
That's the very legs the health center stands on, named after two West Michigan medical pioneers, for Dr. Eugene Browning and Dr. Robert Claytor.
They are one of the first Black physicians in this community and in Grand Rapids area.
Dr. Claytor moved to Grand Rapids in 1936. He was the first Black physician to receive hospital admitting privileges in Grand Rapids at St. Mary's Hospital.
Dr. Claytor, he loved this community and he always wanted to improve the lives of the Black community.
Dr. Browning was the only African American in his class at Detroit Medical College in 1905. Moving to Grand Rapids, he held weekly well baby clinics for the community.
Both did this to kind of bring equality and access to health care for those who are under-resourced.
Now, that legacy continues at a place with their names on display.
It's just so important to have this community, this health center in the heart of the city to service.
The clinic has translators, a monthly mammogram bus, a veggie truck, transportation options, just to name a few.
It helps a lot with family who doesn't have the means to provide for those sources.
For Doris, getting preventative and consistent health care has made a huge difference.
My health is great. I just turned 71 and my A1C is right around 6. My diabetes is between 90 and 93. It's been like that for 7 years. And that's only because of my doctor and the staff.
Some brick walls and a friendly staff can be life-changing.
There's nothing more frustrating than having a health care concern and you have no way to address it. And no one cares enough about it to help you, but this place does.
Elena, what are some of the other things this wonderful health center does for the community?
Well, Juliet, it is help funded by the Trinity Health Foundation, and they also host some events like, I'm told, a backpack and school giveaway for students, or school supply giveaway for students in the area, free blood pressure cuffs for patients, and financial assistance for the uninsured and underinsured.
That's so much. Thank you so much, Elena.